Hi, my name is Danielle Hausman. I'm an occupational therapist and rehab educator at the Craig Nielsen Rehab Hospital. Thank you so much for watching this video about the process for safely returning to driving. Please take a moment to read over this disclaimer. Here's what we'll address today in this video. So we want you to know the appropriate time to discuss the possibility of returning to driving with your doctor and your therapy team. We want you to know the process for and the potential interventions for returning to driving, and know who must be contacted after you have a driving evaluation so that you can safely get back on the road at the appropriate time. So first, why should you have a driving evaluation? So you need to have documented medical clearance before you get back on the road after you experience a neurological event. And this is for the physical safety of both yourself and other people on the road. And also to protect you both legally and financially. That if heaven forbid you are in an accident, there needs to be documented medical clearance that the doctor said that it was okay for you to be back on the road after you've experienced your neurological event. So before we consider having a driving evaluation, you need to make sure that you're off of any pain medications and other medications that can cause dizziness, confusion, or drowsiness. In other words, medications that you're not supposed to be driving on. And next, we need to make sure that any precautions are lifted, that you're able to fully bend, lift, and twist your spine, that you've gotten that full clearance from your surgeon, making sure that you don't have any weight-bearing precautions, particularly any arm weight-bearing precautions, and that you're out of your cervical collar or other type of supportive brace so that you can bend, lift, and twist your neck and your back in order to be able to check your blind spot. And so the timing of this evaluation should be discussed with your doctor and your physical, occupational, and or speech therapist. And the next thing to think about is being able to access your vehicle. The first step to independent driving is being able to get in and out of your vehicle, and also consider if you use a wheelchair or other mobility device, where that's going to be stored while you're driving. So you need to consider your vehicle type, if it's going to be a good fit for you and your mobility device, how long you're going to have this vehicle for, and how your mobility device will be transported. So before you put any money into or make any adaptations to your current vehicle, make sure that you'll safely be able to access the vehicle. So what exactly is a driving evaluation? So it's a very thorough 2-hour appointment with an occupational therapist. So the closest place to the Craig Nielsen Rehab Hospital to have this driving evaluation is our Sugar House Outpatient Clinic, where we have an occupational therapist. Her name is Brooke, who's a certified driving rehab specialist, one of the only ones in Utah. So this will be a 2-part evaluation. That first is a clinical assessment, followed by a behind the wheel on the road assessment. So for the clinical assessment, your therapist will take a very close look at your vision, your cognition, your thinking abilities, your strength, range of motion, coordination, and your reaction time. And part of this will be evaluated through what's called a driving simulator, which is a very realistic machine that simulates what it's like to be on the road. And next, at the appropriate time, you'll get into the clinic's adapted vehicle. So if this is happening at the Sugar House Clinic, you'll get in the RAV4. And the vehicle is fit as a driving instructor vehicle where the therapist has access to an emergency brake if needed at any time during the assessment. So almost always you'll get on the road to do the behind the wheel driving assessment during your driving evaluation appointment. And if needed, at this time you'll have the opportunity to try out the 6 different types of vehicle controls. Your therapist will work with you to determine the best placement of the controls on the left or the right side, and you'll also look at electric versus mechanical controls. And when you do choose which type of hand control system you would like, it's important to have it professionally installed in your vehicle for safety. Unfortunately, a driving evaluation typically isn't covered by health insurance. There's a couple of exceptions, such as workers' compensation and VA insurance, but most of the time it's an out-of-pocket expense. And at the time of this video recording, the current price at the Sugar House Clinic is $250, and that's an already discounted price that needs to be paid on the day of service. And you can call the Sugar House Clinic at the number on the screen to schedule your driving evaluation at the appropriate time. So after the driving evaluation, your therapist will fill out a form. That's on this form. It will be reported if you have any restrictions, and you can pass with or without restrictions. It'll also be noted on this form if you need any adaptive equipment to drive. And this must be reported to the DMV in person when there's a modification that's going to be added to a vehicle. And in the state of Utah, as well as several other states, you do need to do a second on-the-road test with the DMV with your personal vehicle, with the actual equipment that you'll be using at this time. The driving evaluation is done in the clinic's vehicle with the clinic's equipment. And this medical evaluation at the DMV is at no cost to you. And if you live out of state, it's best to call your DMV to see what their procedures are. And here are some examples of different driving restrictions. So you may be allowed to drive, but only with another licensed driver in the car or during the day, possibly non-highway driving on streets where speed limit is 40 miles per hour or less, and with any adaptive equipment that you need, that you can only drive with the adaptive equipment. So if you don't pass the assessment on the first try, we would recommend doing driver training. So you can schedule this at the Sugar House Clinic in 1-hour blocks, or there are several different driving education agencies that you can utilize. So to summarize, it's important to have a doctor's clearance prior to participating in a driving evaluation, and make sure that your whole therapy team agrees that it's the right time to do the driving evaluation. It's also important to only work with certified driving specialists and to have any equipment that you need installed by professionals. And always report any changes to your driver's license to the DMV and participate in the medical on-the-road test through the DMV. Please contact your primary care team with any questions.